Hello, my name is Elizabeth Kleinhenz, and I'm a dual Master's in Social Work, Master's of Public Health student at The Ohio State University. I'm presenting on behalf of myself and co-authors Madyson Arra of The Ohio State University College of Nursing and Max Melchioris of The Ohio State University College of Medicine and Max M. Fisher College of Business. Our presentation is titled Anti-Racism in Action, Implementation of a Student Proposal in Interprofessional Education at The Ohio State University. Systemic and personally mediated racism impacts both patients and practitioners in the healthcare setting. To better meet the needs of diverse practitioners, it's crucial to train current students to recognize racism and respond to it collaboratively in a team setting. The Ohio State University's Interprofessional Practice and Education curriculum, called BUCK IPE, enables students to learn about, from, and with other professions in the healthcare field. In the spring 2021 semester, there was a BUCK IPE learning module called Anti-Racism in Action, a personal and collective responsibility. In this learning module, student interprofessional teams developed action plans to address racism in the campus setting. Our action plan was selected as the exemplar of over 200 submissions. An adapted version of our action plan is currently being implemented in the BUCK IPE curriculum as the spring 2022 version of the Anti-Racism in Action learning module. In this learning module, based on our action plan, students are split into interprofessional teams that complete synchronous and asynchronous activities throughout the semester. Teams receive education to ensure a baseline understanding of various forms of racism, anti-racist practice, and related concepts. Teams analyze case vignettes, highlighting the impacts of microaggressions on both patients and practitioners. Students deliver presentations on structural bias and team dysfunctions reflected in the cases, as well as appropriate responses. Specifically, teams will be prompted to adopt the perspective of one person in the case and analyze how they would respond to other team members to address the microaggressions at hand. Crucially, a safe learning environment will be promoted through various safety protocols, including trained facilitators, ground rules for teams, and on-call diversity officers during synchronous portions where students come together with their teams and interact directly. Delivery of this learning module to students is currently ongoing. The first cohort of students participated synchronously on February 16, 2022. Teams will continue completing both synchronous and asynchronous activities for the rest of this semester. Broadly, learning objectives of this learning module include greater knowledge of privilege, cultural humility, forms of racism and anti-racist practice, impacts of racism on both individuals and communities, and roles of team members, both individually and collectively, in providing anti-racist care. By the end of the spring 2022 semester, this learning module is anticipated to reach over 1,000 students, representing 9 health science colleges at The Ohio State University. Ultimately, supporting diverse healthcare colleagues may require navigating complex team dynamics and interactions. Thus, racism in the healthcare setting is an issue that must be addressed interprofessionally, not just within single professions alone. Our Anti-Racism in Action learning module represents a high-impact intervention in medical education. It is our sincere hope and expectation that students who complete the Anti-Racism in Action module will emerge better prepared to create a welcoming and safe environment for diverse healthcare colleagues. Thank you.